Moving on from doing the stationary cupping of the hamstring and calves, we're now going to start doing the massage side of it. So I'm going to take these cups off. I'm going to leave a couple of the medium-sized ones. I may even, no, we'll leave those for now. The good thing is, obviously, when you're doing your cupping, obviously, if you've got all your cups and all the different sizes inside of you, it's quite easy to interchange sizes as and when you need to, and add more if you feel like you need to as well. So just as we did in the upper back, we're now going to apply the medium, whether it be oil, wax, or whatever it is, lotion that you're using, and you would massage as you would normally. And this is when you're going to start to feel certain areas are tight, and areas in which you're going to want to work. Remember, if you, when you've started your treatment, you find an area is quite sore, that's when the stationary cupping is going to come into play to help loosen those areas off. Okay, so you've worked through and you can feel actually, yeah, there's a bit of tightness just there, and I want to just try and relieve that and get some lymphatic drainage through there, lifting the skin and just helping loosen those areas off. As you can see through normal massage, putting pressure down is quite compressive, whereas obviously with cupping therapy, it's quite the opposite. Okay, so looking at the hamstring, yeah, I'm just going to put one on to start with. I'm just going to start with one pump. Now remember, when we're doing cupping, we need to make sure we start light, especially when moving the cups, because it might feel absolutely fine in some areas, and then all of a sudden you get to one area and it just doesn't want to move. The pressure in the cup is exactly the same, but the area is so tight that pressure is suddenly a lot more than other areas. Okay, so always start with a nice light pressure, gently working through that area as you would with massage. You can go longitudinal, you can go transverse. So I'm just going to pop it there. There we go. So we can come across in more of a transverse way. If it keeps popping off, you might want to go for a smaller one. There we go. Excellent. Getting into all those areas, working both medially and laterally. And again, if you find a particular area which is tight, you can leave the cup there and then get another cup and do the same again. Okay. Excellent. So just as I did with the back, there was just a particular area here that's quite tight. So I can show you if I go slowly. If I put my finger on and going at a certain, same pace, same pressure, you can see that the cup is now starting to slow down. My pressure is the same. It's just slowing down because it's getting tighter. Okay, so the fascial, I'm now going to put more pressure down to get it to go past. So it will go past, which is good, but it's just a little tight. I'm going to put more pressure on through that area to get it to move. So at that point, I've got two options. I can leave the cup there and use the other cup to work around, maybe go onto the calf, or I can put more pressure through it to a level that is okay with your patient. Remember to check, and then start to push the cup. Okay, so we can support the area and then push, and just put a little bit of overpressure there. So what we're doing is we're stretching those soft tissues now. Okay, we're stretching the fascia. Just putting a little bit of pressure through that. Excellent. And then we might want to pull the other way. To be honest, as I pull that way, I can actually start to feel it slide, so it's not too bad that way. I want to push it in the way that it doesn't want to go, because that's the way it doesn't want to stretch, so that's the way we need it to stretch. Okay. And then I'd take the pressure off. put the same pressure on as I did a minute ago, and then go back over that same spot. And as you can see, it's gliding really well now, okay? Hardly, in fact, it's going nicer at that point than it is the 2 points either side of it, okay? So that's worked really nicely. So that's for the hamstrings. Like I say, you can go up and down, you can go transverse, entirely up to you. You can start to put one on one end, one on the other, and then you can start to stretch through, stretching that fascial chain, okay? Making sure that you avoid the back of the knee. Excellent. Or we can use one in one area as we use the other one. So that's now stationary as we use the other one to massage, or we can put more pressure through one and really stretch that fascia by putting overpressure on. Okay, so we're going to do exactly the same but for the calves. So I'm just going to take those off. I'm going to use a smaller one now. Now this one again, because it's on a smaller area, as we start to move, I might find that I want to use a smaller cup again, but we'll see how we go. We can always change it. I do want to go for as big a cup as I can, but if it keeps popping off, then obviously that's an indication that it is too big. So going longitudinal. There we go. Or we can go transverse. You feel that then? I think we got a little bit of a spot there. Okay. So that's a perfect time. So there's a little bit of something just there. So I'm just going to leave that spot there. And I'm actually going to get a slightly smaller one because I want to be able to work around. But you don't want to, again, just as you wouldn't want to go too big, you don't necessarily want to go too small either. The smaller the cup, it's quite concentrated. So these ones do tend to bring the blood up a little bit more. How's the word? They can just look a little bit more pinker quite quicker, okay? And they can be a little bit more tender. So just be mindful of the really small ones, not to put too much pressure on. And it might be a little bit too much there because it was just feeling, is that feeling a bit tight over that spot there, Laura? Yeah, it's quite tight there. So I'm actually going to leave that one alone because as I was explaining, this one's been on there enough. So I should be okay to start moving this one. As you see, it's just a case of feeling what your patient needs, moving around and just loosening off all those tight spots that you find. And it might be interesting because these spots that you find might be different to the spots that you find in the muscle as well. Okay? Because remember, we're working on the fascia, but they do tend to link hand in hand. So there's something just about there. So I'm just going to start to work through this spot now. That feels a bit better. Does that feel better to you, Laura?
Yeah.
Good. Bit tight there. I'm going to come back to that one. As you can see, I'm literally just going from one to another, longitudinal, transverse, working through, making sure I get all of those spots. You can go quite quickly, or you can go slower. Entirely up to you. And again, what is it you're trying to achieve from your treatment? Okay, if you're going over something that's really tight, you don't want to go fast. Okay, it'll be more uncomfortable. So, and you'll miss the spots because you'll just fly over them. So slower is better, but sometimes you want to go a bit quicker because you want to bring a bit of heat into the area as well. So as I repeat myself on a regular basis, depends on what you're trying to achieve from your treatment. Okay. So I'm just going to take that one off for a second because around the ankle is quite tight. So once again, I'm just going to put a little bit more on, only a tiny bit, okay? Just want to, enough that it doesn't want to move, so I can put that pressure on there to really stretch those tissues now. And I'm just going to hold that whilst I wait for that release. Like any stretch, you know, you want to be on there long enough that you're going to have a response, but you don't want to be doing it for too long. 10 to 30 seconds really. Enough that you're there, you know, you're spending enough time in that area, you're actually going to achieve something, but not too long that you're actually going to aggravate it. So that actually feels like it's loosened off because it's starting to move. Whereas before it wasn't moving at all. So I know that we're in a good spot there. So I'm just going to put a bit of pressure on again. Good. And that's moving about a lot easier. Excellent. Excellent. So that is how we use cupping for both stationary and massage for the hamstring and the calf. Another method that you can use for the hamstring and calf is pin and stretch. So I'm going to show you a couple of those methods before we move on to other areas. So a pin and stretch, if you use it within your practice at the moment, the point of a pin and stretch is if you're imagining the muscle, so you're imagining where it originates and where it inserts, what you're trying to do is pin halfway so that you are now creating a new insertion point. So what we're trying to do, instead of stretching the whole muscle, we're actually starting to create a stretch through between your thumb, or the cup in this case, and where the insertion point is. So we create this new origin, and then we're stretching that part of the muscle from that point. Okay, so if you've got a tight spot around here, you might want to pin either on that spot or just above it. Okay, so for the hamstrings, if we think about what the hamstrings do, when they contract, they flex the knee. Okay, so what we want to do is we want to bring the hamstring into a flexed position, put the cup where we would, so you just hold your leg for me, Laura, perfect. Where we would put our thumb on a pin and stretch, we're going to do the same but with a cup. Okay, and at that point we're just going to ask our patient to drop the leg down and then back up again. Perfect. And then let the leg drop back down. Perfect. And back up. Aiding on the way back up, so they're not using the muscle too much, but they're stretching on the way back down. Okay. Where you put the cup depends on where you feel is the problem. Okay, so it's not you always put the cup there. If you find that, you know, there's a problem here, that's where you put the cup, but maybe the problem is here, so therefore you put the cup higher. Maybe the problem is more medial, so you'd put the cup more medial. So again, depending on what your patient is feeling and what you're feeling when you are treating. Same with calves. So calf muscles do the plantar flexion of the ankle, okay, so the pointing of the ankle. So what we're wanting to do now is starting to dorsiflex the ankle, okay. So again, depending on what or where you feel the problem is. If, for example, I'm thinking it's more medial gastroc, I'd put the pin there, and then I can simply help to stretch through the muscle as the cup is on. Okay. As the gastroc does cross the back of the knee, ideally you'd want to have the leg a little bit straighter and you can push through there. If you want a really good stretch, you could then take away the pillow and have the leg hanging off the edge of the couch and do the same thing. So ultimately, depending on how flexible your patient is, how tight the area is, and you could always start with this motion, take the cup off, have a feel of, see if it's actually loosened off. If it hasn't, it should have loosened off enough that you can then go and make it a little bit more intense by taking the pillow away, having the leg a little bit longer, so you are really stretching through those muscles, okay? Always boils down to knowing your anatomy. Know where your anatomy, originates and inserts so that you can fully stretch and activate those muscles properly. So in summary, you can have, when we're looking at the hamstring, we can do stationary cupping to the top, so one either side. You can have, so you'd have 4 in total. You could just do one side or the other. or you could go directly down the middle and maybe have 2 or 3 down the middle. Okay, you don't have to always stay with the same size cup. It depends on where you're working. So obviously here I've got 2 medium and a small. Okay, and that would work quite nicely as obviously the leg tapers off. Avoid the back of the knee in that popliteal area. Cupping, stationary cupping to the calf, exactly the same. We can either go down the middle or you can go either side, just on one side, both sides, entirely up to you, depending on where your patient needs it. Massage, when we're massaging with the cups, so when we're gliding, we're going to go longitudinal, or you can go transverse, or a mixture of both. If you find a particular spot that is tight, you can leave the cup in that area and then use another cup to continue the treatment. Once you find another spot, you might leave it there and then start to move that cup. Okay. You can put 2 cups on and work fascially, so you'd work along those fascial lines, slowly pulling apart. If you find a particular spot, you might put more pressure on than normal, just so it doesn't move, so that you can then overpressure and start to push against that fascial tightness and really feel that stretch. Then when you take that pressure off, go back over it, it should have released down. Exactly the same, but on the calf. So again, longitudinal, transverse. You can do the fascial release, find one spot, overpressure and push against to stretch the fascia. Okay. We showed you a pin and stretch, so depending on where you find that particular tightness, thinking about what the hamstring does. Obviously the hamstring bends the knee, so flexion of the knee, so we want to then obviously go through extension. Okay, so you'd find the spot where you'd want to put the cup, either on the particular spot or just slightly above, and then you would aid the leg up and let them take the leg down. Okay, you want to do that a handful of times, 5 to 8. Okay, you may not even need that many. It depends on, again, what you're working on, how you feel, how tight is it? Do you feel like it's going to need a few more activations than normal? Whatever you would do normally with your pin and stretch in your own practice is exactly the same with the cup. And the same with the calf. So find the spot that you would work on, whether it's medial, lateral, in the middle, kind of soleus, and again we're working through. Think about those origin insertions. So obviously as I bend the knee, I am now taking a bit of slack off the gastroc, but I'm still going to be stretching as I dorsiflex the ankle. But if it's not as much as you need, simply lowering the leg is now taking the gastroc into more of a stretch and then dorsiflex from there. So at that point you may need to move the pillow or ask your patient to drop their leg off the end of the couch. Obviously if you're doing the soleus doesn't cross the back of the knee, so in this position is fine, and you can just work through at that point, working with the dorsiflexion of the ankle. Fabulous.